Welcome to Season 7 of Purposeful Empathy, a show that's dedicated to amplifying the voices of people from around the globe who believe the world needs more empathy and are doing something about it. Today's episode is brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching. Enjoy the show. Welcome to a new episode of Purposeful Empathy. Today I'm joined by Christine Bechtel, who's the co-founder of X4 Health, a purpose-driven organization that uses social impact design to solve problems. She is a nationally recognized expert in advocacy for patients, digital health, primary care, and quality healthcare. The team at X4 Health has pioneered a national initiative in the US called Third Conversation to reinvent the doctor-patient relationship and create meaningful systems change. Welcome to the show, Christine.
Thank you so much. It's great to be here.
Yeah, I am so delighted to speak to you. I'm actually in the final stages of writing my chapter on empathy superheroes. And of course, everybody who's working on any of the front lines of healthcare are superheroes in my book. And I was put onto this op-ed you wrote for USA Today, describing something that happened to you in a doctor's office. And you actually in your op-ed say that the doctor-patient relationship is collapsing. Can you tell us a little bit what happened and why you think that's the case?
Yeah, so I'm a new resident of Fort Myers, Florida. And when I went to make an appointment to get a new primary care doctor, I did what everybody does. I asked around all my friends and got a recommendation. And I, at that time, was under a lot of stress and strain. I had just gone through ending a friendship, a lifelong friendship, literally the night before my appointment. So I was a little bit, out of sorts. And when I got there, what I noticed immediately was just how little eye contact the physician was making with me and how much attention she was paying to her computer screen, which is not unusual in healthcare today. And it's absolutely not the doctor's fault by any means. We can talk more about why that is. But even in the face of me telling her that I was really having a hard time, I'm going through a lot emotionally. The first thing she said to me was, well, I really can't be your doctor. And I said, well, what do you mean? Like, why? Well, you don't live here the entire year. I said, but I'm here 8, 9, 10 months out of the year. So immediately I felt very upset by that. And then it just kind of spiraled down from there. She asked why my blood pressure was so high. I've never had high blood pressure. I didn't know until she said that, literally, that I had high blood pressure. And and at that point I just lost it and started crying. And she, fairly robotically, sort of handed me the tissue box and then went back to her computer screen. So what I realized in that process was, and I'm giving you surprisingly the short version, that I think we have forced physicians and other healthcare professionals into a place where they have to just document everything. It's about productivity. It's about how many people can you see in a day? I got to get to the next thing. That it's really eroded the relationship between clinician and patient. And yet we know from medical literature that relationship is not only the vehicle for empathy, but it is also something that is hugely professionally rewarding for doctors, and it really contributes a lot to better health outcomes for patients. So it was such an awakening to see this, happen, so much in this visit that I wrote an op-ed about it.
I'm so sorry to hear about the friendship coming to an end, and I'm so sorry that you had to have that circumstance play out. I just imagine for so many people who are in doctors' offices in the most vulnerable situations, either aging or having an illness diagnosed, or it's never fun. You're never really thrilled to go to the doctor for an appointment, unless you're pregnant, maybe, and looking forward to that. And I think that relationship is so crucial, and empathy is such a big part of it. So I'd like to ask what inspired you to start Third Conversation. You've been a longtime healthcare advocate. What is Third Conversation, and what's the backstory?
Yeah, it was actually experiences like the one I just described that that inspired it. It's worth saying, I don't actually have permanently high blood pressure. It was just, the emotional experience of the day before and of that day. But I will say, my co-founder, Jen Sweeney, and I, when we created this, she's also a patient advocate. We spent our careers talking with doctors and other health professionals, talking with patient advocates. And what we realize is they're totally two separate conversations. The patients are over here on one side saying, oh my gosh, this healthcare system is so frustrating, so hard to navigate. Or, oh my gosh, I had a great experience. I finally found a great doctor. And then it's really the doctors and the other kinds of healthcare providers in totally separate conversations saying, oh my gosh, I'm exhausted. This is such a hard, system to work within. This is not what I signed up for. This is not why I went to medical school or whatever school. And we realized they both were suffering from some of the same problems. It's the same system that they're working in, and they don't talk to each other. And so we asked ourselves, what would happen if we just helped them sit down together and have a conversation? We also knew at the time that depression amongst healthcare providers was on the rise pretty significantly, and suicide rates were climbing. So burnout, professional burnout is skyrocketing now. It was on the rise then as well. And we just thought there has to be something that they can do together. And so we brought them together really as the two sides that have the most to gain if the system is working well, but also the most to lose when it's not. So, yeah.
So the first thing that comes to mind when you're talking about it, these two separate conversations, it's almost like you're bringing people who are politically and ideologically opposed together to kind of like understand each other's side of the story a little bit. Is that how it plays out?
It is. It's very, we use a lot of nonviolent communication tactics, which is about really listening deeply and helping people in both roles feel seen, heard, and understood. And in that process of developing empathy and understanding for each other, they end up taking off their role-based hat and just connecting as humans. And as you know, the science of empathy really tells us that when you can create those aha moments where you finally understand the other person, it almost always sparks a desire to also help that other person. So we use that. We use appreciative inquiry, which is how do we think about those best of moments in healthcare or those MVP moments? What enabled them? How can we make more of those great, moments happen? We then help people dreamstorm together. So not brainstorm, but really dreamstorm from that place of bi-directional empathy. And then we pull together that sort of systems level thinking that comes out of appreciative inquiry with those moments of individual empathy and help them really describe a system that is different and that is really meeting their collective needs.
So you've used this interesting term, bi-directional empathy. I think I understand what you mean, but maybe we could unpack it a little bit, because I know for you, you think bi-directional empathy is actually the key to unlocking a lot of systems problems.
It is. We teach some clinicians later in their training empathy. And we really, when we're talking about empathy in healthcare, we are almost always talking about the clinician, / provider, doctor, nurse, really empathizing with the patient. But we never do it in the reverse. We don't, have people who say, oh gosh, doc, like how's your day going? What's happening? And, I'll never forget, we were in a third conversation event in Camden, New Jersey, and a patient named Cynthia, she said, I was in the ICU and I remember the doctor coming in and talking to me, and he just looked so tired. And so she said, how are you? And he's like, how am I? Oh my gosh. Why are you asking me how I'm doing? Like, how are you? And what she said to him was interesting. She said, look, this is stressful for me. And so this has to be stressful for you too. You're a person. And he melted down and cried. And he said, I have been a doctor a long time, and this is the first time that anybody's ever asked me how I was doing. And all she did was really recognize him as a person. And she just really triggered his own humanity and their common humanity. And it opened up a new channel of relating to each other. And so that's what I mean by bi-directional empathy. It's got to go both ways.
Gosh, you've just put a little, you've just like turned the Rubik's Cube for me for a moment. I write about this in my book. I had these experiences when I was having my daughter. So I had a very, very long labor, but the plan was to have a natural childbirth in water. I was not giving birth in a hospital. I'd gone through what is they called with a midwife, a sage-femme in French. And, I'd been doing hypnotherapy. I had imagined this like entirely different birthing moment. And 65 hours later, that I was, after my water had been broken, after my midwife said, I think I've done everything I can. We've waited as long as we can. You get off to the hospital, and I waited, within those 65 hours, another 10 hours was spent at the hospital, still with contractions. I wasn't dilating, all that. The doctor who ultimately performed a C-section on me said to me, even though that was the last thing I wanted to do, said, in my experience, I think we could still wait many more hours, but I don't think things are going to change. And I think you're exhausted. And he said, for a birth to happen really well, the top of the head has to be in position, but your daughter's chin is up. And he said to me, don't you want to meet your stargazer? And it was like the way he said it, I just felt like this flood of empathy. And so I was off. I went to the operating room and my daughter was born, and I have no regrets, right? But by comparison, a few hours later, I'd sent my husband home. He hadn't slept for 2 days, but I was like high on oxytocin and all the feel-good hormones, and I was probably stoned a bit too from morphine. My daughter was like sleeping on my chest, and she was she was nursing. Everything was going well, but at one point, like at 4 o'clock in the morning, I really needed to pee. Like I really needed to pee. But I just had a surgery and I wasn't able to like move my daughter over and get up and walk across the room to the bathroom. So I was like ringing the nurse's station. And I was really careful the first time I rang to wait like 10 minutes before ringing again. And then I waited as long as I could. I ended up ringing 4 times, and I think it was like over half hour that I waited. And finally, I couldn't wait any longer. So I peed myself in bed, which was not one of my finest moments. But 2 or 3 minutes later, ironically, a nurse was doing her rounds and came in, and I shared with her what had happened. I was kind of mortified, but I shared with her what, apologized. And she blasted me. Like, she was so angry with me. She was just hostile. Wow. And I was crying. It was just like a terrible feeling. And I always think about those two experiences in juxtaposition. But the reason why I'm bringing this up is that you've provided a new frame for me to think about this nurse who knows what she just lived, who knows what her whole shift was like. And she maybe didn't mean, and maybe I was hypersensitive. Maybe it wasn't all that bad after all. Like, you know what I mean? Like, just like you said, to have humanity for doctors.
Yeah. It's interesting because that's, first of all, such a difficult story for all the reasons you just articulately described and experienced. I think that for some of our worst of moments, we don't, it's 9 times out of 10, it's not the human. It is the larger context in which they're operating. And I remember that a patient at St. Luke's in Allentown, Pennsylvania, during one of our events said, I walk in the door not realizing what your day is like. And so I unload on you, and then I take the medication or whatever it is, and I walk out the door and I'm still thinking about me. And I don't think about how I'm adding to how good or bad your day is. And maybe, he said, maybe thinking that way actually makes it just a little bit worse for everybody. And we all compound it like every time we walk in the door. And I like that sentiment in the sense that, it really clarifies that patients have a role. And I think your experience, though, is different in that it really points to the fact that there's something happening in the system and the culture of the system and the workplace conditions that are creating a moment where a human like that, who's in a care provision field, could unload on you in that way. That's obviously it's no good. And it's almost never that person is evil, in some way.
Today's episode was brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. So Christine, that brings up an interesting question then, is that, I so deeply appreciate the process that you guys have worked on with the third conversation, where you're learning about each other's perspectives and really listening for that intention to understand and empathize. But then there are these systems that exist that actually sometimes don't facilitate those kinds of dialogues. So how do you kind of navigate those both levels?
Yeah, most systems don't really facilitate those types of dialogues. So we work with a lot of different types of health systems from many different places. They all have different structures. So Oregon and California to Atlanta and Mississippi to Rochester and Boston. How we navigate them, interestingly enough, it is actually not their leadership, like their C-suite, their administrators, that come to us and say, oh, we need to do third conversation. It's almost always a mid-level health professional, a PA, MD, whatever, who wants to create change in the organization, sees that the organization has real challenges, but believes that there's some potential for improvement and knows a little bit how to navigate the organization. So we've sort of nicknamed them the organizational rascals, if you will. And we have two different experiences or event types that we can do. One is called a Spark event, which is half patients and half healthcare providers, interprofessional, very diverse event. And we call that the Spark event because it really sparks a different mindset, a different awareness, and a different understanding of each other. And then the second experience is called an Ignite event. And that is reserved for healthcare professionals and their leadership, the C-suite. They're all professionally facilitated. We did them in person before COVID. We do them virtually now, and it's just as powerful. Actually, by the way, we had a patient yesterday tell us that it was even more powerful because it was on Zoom. It wouldn't have happened, otherwise. So that was fascinating to me. And the events essentially help people see that they have common ground. We pair them up individually, in the two different roles. So they talk about their experiences, their clinic, their system, and then they unpack those moments in order to, again, after that spark of empathy, how they envision a different future together. What's, I think, different about these events is they are about being versus doing. So in healthcare, right, this is all about what you have to do. You have to go here. You have to get this thing. You have to document in your chart. You have to refer over here. It's all about doing. But when health professionals and patients come in here, they are not leaving with a list of action items. They just get to be a different way. And that's profound. And so our senses and our evaluation data helps us understand that when you can change people at that individual level by giving them this very different experience, it has a ripple effect in the way that they show up in the world, having felt really, truly seen, heard, and understood, often for the first time, or at least the first time in a long time. So they end up leaving with new relationships, changing workflows, changing the way they're going to prepare for doctor visits or the way they're going to interact with the healthcare staff. And it's really all about just facilitating that high quality human connection.
Because I imagine, most people who go into the healthcare profession, whether it's to be a doctor, surgeon, or nurse, they're all called to it, with maybe some outliers, but all called to it with the desire to serve and to heal and to care for people's health and well-being. And if the business of healthcare delivery gets in the way of that, I can appreciate that when people come together, it probably takes the ethos of a particular organization to want to do this. But once they've had exposure to it, it's like, oh, this is what it's supposed to feel like when I'm in relation with a patient, right? So you're talking about some of the markers of success. Like, how have you been able to evaluate, or what kind of impact are you having? Have you noticed?
Yeah. So, first of all, the impacts that we are learning from our participants, one is that the experience itself is healing and it is a relief and it helps address their burnout. Now, we talked to an institution last week, by the way, who just surveyed their doctors and nurses. 90% of their nurses are telling them they are at the highest level of burnout they've ever been at. 50% of their doctors are saying the same thing. So if we can help individuals feel some relief from that burnout, that's huge. It also helps improve patients' experiences in healthcare in the sense that patients and clinicians, the healthcare providers make a lot of assumptions. We were in an event once and a doctor stood up and she said, I always thought my patients were like hiding things from me. And now that I've been in this room and talking with these people as humans, not, in their role as patients, just as humans, what I'm realizing is they're actually just filtering. They're actually protecting my time and trying not to burden me when I thought they were like totally hiding things from me. So, that's one of the gifts of empathy is it helps us dismantle or unpack those assumptions about each other. And I think it's also really dismantling the us versus them mentality that is so endemic to healthcare. Just this past week, actually, I think it was yesterday, a patient wrote to us and she said, I was paired in this event with a physician who was Syrian by background. She said, I'm going to just read it to you. She had said, I had nothing, absolutely nothing in common with this doctor. Our paths would not have crossed any other way if they had. And there's no way that we would, if they had crossed, there's no way that we would have shared and instantly bonded with each other in the way that we did. Our society, she said, actually teaches the two of us not to bond, but hearing about his struggles during COVID as a human and him listening and participating in the conversation about my struggles, it just shattered all of the social stereotypes. And it was life-changing and an eye-opening experience for her. I mean, that's just profound.
Oh, I love that. That's actually really beautiful. But one of the things that you said that just caught my attention at the beginning of your answer was, when I talk about empathy and how it's useful within sort of like the workplace culture, you can imagine, people want to be in psychologically safe environments. There's a new emphasis on EDI and authenticity and coming, with all of your full self to work. And now that we've lived through COVID and we've seen ourselves in the work-life context, like those lines are blurring further. There seems to be like an appetite for more empathy in the workplace. But what leaders I often hear are like, wow, we're like a high performance culture and we really care about our KPIs. And like, this empathy thing might really slow us down or somehow impede us from succeeding. And I'm like, no, actually, workplace cultures where people feel heard and seen and understood, there's more trust, there's better communication, there's, less misunderstanding, more innovation. So that actually has like business results. And what I heard you say initially there was that if there's such an enormous amount of burnout or risk of burnout, that has a financial impact on any organization. And so if you can do interventions that actually allow people to sort of recover or sort of not cross that threshold to burn out, that's an important thing for retention and productivity, right?
Absolutely. I think you've nailed it. One of the biggest things that every healthcare organization right now, and really every sector is facing, are staffing shortages, right? We've had the Great Resignation, but we've also had this sector of healthcare go through COVID and had no ability to pause, process. We went through all this rapid change so quickly to try to accommodate a pandemic, worldwide, but we've never stopped. So now we're in this like race to recover lost revenue from the 2020 and 2021 years where we had to slow down on elective procedures, all these things. And what we're hearing from administrators, which is the C-suite, are two things. One is, first of all, they are just as ground down and burnout by having to lead through that place. And almost no one cares about leaders as humans, right? We have a culture that is really quite us versus them in that arena for sure, and really is finger pointing. And so those leaders have no outlet valve either. And that's really hard for them. Most leaders would give almost anything to have a trusted group of individuals to collaborate and work with. And that's, I think, the potential of what something like Third Conversation can create. But I would also say that we prioritize, as you just said, the technical and the structural in healthcare, which is the KPIs, the quality measures, the RBRVS, the, productivity, all of that kind of stuff. And we deprioritize the relational, but you will almost always hear leaders saying, gosh, I wish I had more trust in this organization. Boy, I wish we could communicate better. All those tricky, hard to do things. That's what bidirectional empathy, that's what rebuilding relationships, that's what getting in a room together gets you. So you asked about the impact of third conversation. I think probably the greatest potential is using it as almost like a primer or a catalyst for that bigger, harder work, whether that is DEI or anything else. You want to launch some major new initiative, you better have solid relationships and trust it, in your ranks. And so how you can create the moments of bidirectional empathy, really rebuilding relationships, that is going to supercharge all of your other efforts and help them go faster than I think they ever would have before.
Yeah, so you've just debunked that whole soft skill of empathy, because it really has big consequence. Penultimate question here. Since you talked about COVID, and we haven't really talked about COVID, I'm curious to hear from your perspective, since you've got, boots on the ground and ears to what's going on. I think healthcare providers must have had like a double whammy of trauma, not only from the workload of COVID, but then also through the misinformation and the politicization of COVID, and what that's meant. Could you speak to that for a second? Because I just don't think we hear about that a lot.
Yeah, I think that's been hard on the relationship, right? Certainly the patient-clinician relationship, and particularly in primary care, cardiology, specialties where you have an ongoing relationship that is really kind of the hallmark of the profession. I think the politicization of COVID has impacted the patient-clinician relationship pretty significantly, at least in those pockets and those communities that tend to be more of our red and purple states. And my sense is it's been hard for healthcare providers to deal with a shift from I've always been a trusted messenger to now this is somehow political, when they're really thinking more about the technical and the science. So I really think that has had an impact on relationships. I also think other aspects of COVID that have been really hard and traumatic, as you said, the staffing shortages, the layoffs that we had to have early on, the big shifts in changing how we do our work and how we do business. We also have masks on that do hide, smiles and facial expressions. It's a little bit harder to hear each other. All of those things have been challenging. And I think it's been really hard for administrators to lead through such massive upheaval, which we're all doing, by the way, in healthcare, but we're also doing in our personal lives. So I think that has been another source of the eroding relationships in healthcare for sure.
My goodness, I think we could probably have the same conversation in education as well. I'm imagining teachers are burning out, and I wonder what it would look like if a student, I'd have to be older students to engage in third conversation, but I imagine it would be possible.
Yeah, I would think so. And I would think also with, the leadership of schools and parents of schools and parents and teachers for sure. Third conversation, I think has been specifically designed and implemented for healthcare. But when we designed it, we looked far and wide outside of healthcare. And I think there's some real potential for any program to utilize some of these concepts that we've drawn heavily from, which are not healthcare specific, but really about forging deeper human connection and bidirectional empathy as the fundamental basis for how we're going to interact with each other and what we may or may not do together. Like that will work anywhere.
Yeah, and wouldn't it be great if that was seeped through the educational system? Imagine everyone was exposed to third conversation type conversations. So, Christine, it's been such a delight chatting with you. I always like to end my conversations with guests on a personal note. So I wonder if you'd indulge a story, if you can think of one, about when you were on the receiving end of empathy on purpose, and what that meant for you.
Yeah, so I probably have a bazillion of them. And I will just say generally, so my father was Waylon Myers, who is a PhD psychologist, obviously a great guy. And he did a lot of work on nonviolent communication, studying with people like Marshall Rosenberg. And when I was young, I was a wild child, to say the least, created lots of problems in the household. And one of the most important, if not the most important things that my father did was to develop a very specific way of really deeply listening to me, no matter how, nutty I was being, and demonstrating empathy in a way that helped me feel seen, heard, and understood. And he did that before we could really move on to, okay, what is the solution? What is the next step? How are we going to solve this problem? And in those moments when he did that, that was obviously very influential for me, but it really helped us move to a place, no matter how upset, either one of us were. And when I did that with him, likewise, it helped us move to a place where we could think clearly and create next steps together, or begin to repair whatever had gone wrong. And so I'm deeply grateful for that experience with him. And I think it really showed me a lot that I bring into my work around how can we create contexts or containers in which conditions like that can flourish.
Well, I love that story because my daughter's turning 6 in a couple of weeks. And so I know that our conversations are going to get more complex and the dynamics will become more complex. So I'll keep that in mind. But I love the way it's come full circle, and that you're now paying it forward, and that, that kind of dialogue or listening with empathy is now showing up in these conversations between healthcare providers and patients and providers and leadership. So thank you so much for this conversation. Good luck with your work. It was great to meet you, Christine.
Thank you, Anita. It's so nice to be with you. Appreciate it.
Super. So thanks everyone for listening and watching. We'll see you next week at Purposeful Empathy.
What if you had access to your own council of coaches to help you break free from your thinking clutter, make that important decision, or liberate you from whatever is holding you back? At Grant Huron International, you get to choose the coach of your choice anytime from anywhere. Visit granthuroninternational.com and harness the power of on-demand coaching today.